CDC has never done any study comparing one year to the next. They've
Right.
never compared the full vaccine schedule to no vaccines or to partial vaccines. They just don't do that. We looked at every single patient born into my practice up to the point of that data set being closed. We had 10 and a half years of data. It was published in the International Journal of Environmental Research and Public Health, and this was the largest real-world patient data vaxxed unvaxxed.
So then, to be clear, what you decided to do was, okay, but I do have a large group of children in my practice that use the CDC schedule. So I have all of the evidence that they provided. And then I have the other ones in my practice that didn't use the CDC schedule. And I can compare the two schedules that way. Is that basically what you decided to do?
Well, close. So
Okay.
we were definitely looking at every single patient born in my practice. There
Okay.
was no cherry picking. There was no, we're going to exclude you for this or that. Every baby born was looked at, and we looked at every single office visit. We stratified them according to the number of vaccines they had.
Okay.
So basically we had over 500 who had 0 vaccines, and then we had another 3,700 and some who had some vaccines. And what we found, Del, was actually even mind-boggling for myself. I mean, I had a sense, I've had a practice now for 14 years where parents get to decide. The one thing I am absolute on is informed consent. You, the parent, get to decide what gets injected into your baby, if anything. You
Right.
should always insist on that, or else walk out of that doctor's office. But because we do informed consent, we had a growing number of unvaccinated patients. And what I was clearly seeing was these kids don't get sick. They don't get chronic conditions. Well, the data spoke for itself. And you're showing your viewers the
Here it
graphs.
is,
Those
yeah.
orange lines are over time, over that 10 and a half years, the more vaccines you had, the worse you were for whether we looked at infections, ADD, ADHD, neurodevelopmental issues, eczema, allergies. It doesn't matter what we looked at, even just plain old anemia skyrockets in the vaccinated when compared to the blue line, the unvaccinated.
Wow.
This data is so powerful that within 5 days of it being available online, they yanked my license. December 3rd, 2020, the Oregon Medical Board had an emergency meeting, suspended my license. I was supposedly a threat to public health. I'm going to talk to the doctors here for a minute. When we were in school and all through our training, we've been taught that for any procedure, we should give informed consent. Now, what is informed consent? This is where I will tell the patient the benefits, the risks, the alternatives. So what their options are. You know, surgeons do it every day. Any surgical procedure, you need to explain why you feel it's important they get that surgery, but also what their options are if they don't do the surgery. What are the other alternatives, right? When it comes to vaccines, folks, this is a medical procedure. This is a definite invasive intervention. We are injecting substances into an otherwise healthy person to prevent some future illness. And there are huge benefits to vaccines. I am a pro-vaccine doctor. But there are also known side effects. You may, as a physician, say, here's the benefits, but in your case, there seem to be these additional risks. The choice is yours, parent, correct? Now that's informed consent. What I see happening is a total destruction of the informed consent process when it comes to vaccines. And let me just say to the parents out there, I suggest you go into your doctor and you ask them what they feel about informed consent when it comes to vaccines. Because if they're not willing to talk to you in a detailed manner about the pros and cons and the risks, the benefits, and the alternatives, you probably should find another physician. Parents, what are you going to choose to do? Let's just take it out of the realm of our children and imagine you yourself, an adult. You're going to walk into your doctor's office and without your permission, they're going to give you a vaccine or they're going to do a medical procedure on you. Will you go back to that doctor? I think not. This is what I see as a developing tragedy in our country because pediatricians, we need to be at the forefront, leading the charge to being the ones who stand by our patients and give them the informed consent process, give them the information, the pros and the cons, and let them make decisions. I've also just joined a new organization, Doctors for Medical Freedom, and this is going to be a nationwide organization of doctors who are basically fighting for the right to have informed consent. We shouldn't have to fight for that right. It is unethical not to give informed consent. I don't know where we are going as a country where doctors are somehow giving up their ethics and allowing a procedure to be just mandated, legislated, and bypassing informed consent. Physicians, I challenge you, think about what you're doing if you're truly going to evade, avoid, or somehow not do your process of informed consent when it comes to any medical procedure, and especially one that could potentially cause some harm. You know, a crazy thing, I remember back in medical school, and that was of course around the time of the dinosaurs, there was something called the Hippocratic Oath. First, do no harm. And I distinctly remember that, yeah, if you might possibly cause harm, you should step back and think twice. That even precedes informed consent, where you know you might cause harm, but you may also have benefit. But at least you're giving the full story. Parents, don't be fooled. Those little one-page glossies from the CDC is not informed consent. Sure, it's helpful, it's informative, but there is a lot more information you need to make an informed decision, and it is your doctor's responsibility to get you that information and let you decide what you want to do for yourself and for your children. Thanks for watching. I'm Dr. Paul.